We're an organization that provides data and information to all stakeholders in the state of Wisconsin as it relates to health care. I think the advantage of that is that both through the constitution of our board, which includes providers, health plan representatives, employers, and others, we have the opportunity to kind of see health care from all perspectives. And so with that in mind, I would start by saying that, I concur that we have a healthcare staffing issue here in the state of Wisconsin and all of the comments that were said earlier. But if I put on my consumer hat and I recognize that, consumers are being hit financially from all perspectives. Everything we buy is more expensive today than it was even 2 or 3 years ago. I would say the number one issue is the cost of health care. So if you look at the studies and the surveys coming out, consumers, 30 to 40% of consumers say that they have difficulty affording to go to the hospital or to a doctor's office or paying for a test or buying a medication, and they have to make choices between whether they do that or they buy shoes for their kids or they go to the grocery store. So to me, we can have terrific quality care, which we are fortunate to have here in the state of Wisconsin. And we could have all sorts of healthcare workers, but if I can't afford to go in and use that system, then to me as a consumer, that's probably my number one issue. At the same time, we know from various state-to-state reports, including HCCI, RAND, and others, that Wisconsin healthcare costs are in the top 10 as it comes to states in the United States. So we're very high quality, and we're fortunate to have that. But we're also a high-cost state. So that puts us, from my perspective, in a bit of a dilemma because we're already a high-cost state. We've got consumers that can't afford to access a healthcare delivery system, even though they have insurance, right, because of high deductible plans. So how do we address the cost issue?